I know one of my friends who also had a diagnosis of PCOS. She was having a hard time actually carrying the baby. And so one of the things that her physician did was recommend doing progesterone injections, I believe is the method that they used. Is that something that you see pretty frequently?
Yeah, so some people have no trouble with actually conceiving, but then they have the trouble, like you said, with carrying. And so they get these repetitive miscarriages. When I hear that, I usually think of the progesterone is not rising in the way that it should. And so they're releasing the egg, the egg and the sperm implantation is possible. And usually what's happening is the body sometimes is in a state of stress too, and that can deplete progesterone. So there's different forms of taking progesterone. There's an oral progesterone that people can take, and there's actually a vaginal suppository progesterone, which a lot of fertility specialists are moving towards utilizing that because it's giving progesterone locally to the uterus, and that can help with maintaining the pregnancy. And so this is something that has to be done with a specialist, and it's not something that a lot of just PCP will do. It's more so OBGYN and fertility specialists because they have to be able to monitor the progesterone levels and also kind of taper down at a certain point. It's usually done within the first trimester of the pregnancy. Leading up to it, there are ways you can help to optimize your progesterone too. So there's foods that women can eat, and two of my favorite foods are actually seeds. So sesame and sunflower seeds, 1 tablespoon of both of those actually help with boosting progesterone levels. So on kind of the fertility journey, I always recommend women to seed cycle. And then there's also some herbs that women can take as well that help to boost progesterone. And Vitex, otherwise known as chaste tree berry, is one of the most common ones. And there's mixed, reviews of taking it during pregnancy. So same thing, I recommend to always check in with a fertility specialist about it. But yeah, progesterone is something that is essential with the maintenance of pregnancy.
And then beyond the medical treatments, you had just mentioned that diet is a big one. Are there certain strategies for diet and exercise that you would recommend?
Absolutely. So for every woman as well who's trying to think about conception, I put them on the fertility diet. 2 areas of health that are essential is obviously diet and exercise. A lot of women are under eating, over exercising, intermittent fasting, having their cup of coffee that gets them to lunch. And so their body's just stressed. So we tried to back it down. I try to get them reduction of coffee, try to swap out with some matcha, get protein, at least 30 grams first thing in the morning, ideally within 1 to 2 hours of waking. That helps with regulating blood sugar as well as hormone levels. So our hormones don't surge throughout the day too. And then with the fertility diet, we want to focus on a lot of omega-3s. So that can come from different seeds, that can come from nuts, that can come from kind of following more of a Mediterranean diet, olive oil, salmon if they like it, the fatty fish, lean meats, a lot of antioxidant-rich fruits and vegetables. I like to say the more colors, the better on a plate, just because we need all of those nutrients to help to support the quality of the egg. So just food becomes a big role when it comes to fertility.
And I know that this can actually be a very challenging area to really shift your mindset from a specific diet to actually incorporating this as a lifestyle change. And everything that you just mentioned is ideal and phenomenal to support your overall health and wellness after you conceive and carry the baby full term. Like you need that stuff for when you're nursing and just continuing on with that lifestyle. So I really don't want people to think of it just as the fertility diet, but making those lifestyle changes before they even try to conceive and then maintaining that moving forward.
Absolutely, because who wouldn't want to nourish themselves and their babies with the highest quality food?
Dealing with PCOS and fertility challenges can take an emotional toll. So I want to take a minute and talk about the intersect between this and mental health and what resources and strategies women can utilize to support their well-being.
This is something that's not talked about enough, Megan. So thank you for bringing this up because I have worked with quite a few women who've struggled with PCOS and struggled with infertility. And it does play a significant role in their mental health, especially when everyone's posting pregnancy announcements, baby showers, and all of these things everywhere. And some people feel like, why me? Why am I unable to? Why is it not my turn yet? I think working with a counselor and a therapist is so important along this journey. There's a lot of different fertility related groups that women can join too. There's different reproductive centers, fertility centers that have these support groups that women can join. And I think, other things that have helped some of my patients too with focusing on the mental and emotional aspect is something called Reiki. So it's energy healing. And what it does is it can help with reducing the burden that we feel on our bodies and just kind of reducing the energetics around the situation of what's happening and get us back in touch with our own selves and our own health.